Hello, my name is Cook-Bey, and I will be going over my project that I did on patient privacy. For the agenda for the presentation, I will be going over the achievement of the project goal and three objectives I used, as well as the completion of strategies with two examples of evidence, specific outcomes for the nursing unit, application practice, and then lifelong learning. So I currently work on a 24-bed inpatient psychiatric unit, and every day we have daily treatment rounds to include the psychiatrist, nursing, case management, and a pharmacist. And we were conducting these rounds out in the open milieu, just at a table. And more often than not, we would have patients at the table either across from us or next to us, just waiting for their turn to see the provider, watching TV. As you know, they can overhear everything that was going on during the meetings. So we were having issues with patients overhearing pertinent patient information. And my goal was to increase patient privacy during our daily treatment rounds. We were in the process of setting up a conference room to be able to conduct these meetings, but unfortunately, the furniture wasn't delivered as well as the door for that room isn't functional, so we had to put in a work order. So I had to improvise, and providers were asked to go into the patient's rooms and conduct their rounds. And if the roommate was present, the roommate was asked to leave. If the provider decided to conduct rounds out in the open milieu, say for instance in the day room, then the other patients were asked to go into the group room. A lot of times we would give out snack in the day room while we're conducting treatment teams. So techs were instructed to not do that and to pass them out in the back in the group so that way there's not other patients that are around and able to listen in on what's being discussed during treatment teams. At the end of the implementation, 81% of patients reported feeling very comfortable with the current level of privacy during rounds, and 80% of staff reported seeing a moderate increase in privacy during treatment team rounds. For my three project objectives, my first one was to interview staff to identify issues with current treatment team rounding system. I wanted to make sure that I heard from staff directly. I also made sure to not only interview nurses, but our mental health techs and case managers. And the results were actually very interesting. A lot of nurses found that during the day, when they did their initial assessment, patients were it seemed like more open and honest as far as reporting that they were withdrawing from drugs and what withdrawal symptoms they were having, as well as any auditory or visual hallucinations. Also, they were reporting suicidal or homicidal ideations, but then later on, when providers and pharmacy and case management were present and we were conducting rounds in the middle of the unit, a lot of times they were not expressing that they were experiencing these things. And nurses felt like this was due to lack of privacy and not wanting their peers to hear certain things that they were going to. Another issue that was brought up is that some patients may overhear discharge plans for their peers, and then they were trying to go to the same rehab program that their peers were going to. And last, another thing that was brought up was that patients would overhear certain medications that were being prescribed, and in turn, they wanted those same medications prescribed, but they were getting upset if they weren't able to have those, which obviously this wouldn't be happening if we were doing treatment teams in a private area where everyone can't listen in on them. My second objective was to provide staff education on new implementations during treatment team rounds. I went over this previously. What I was implementing was to, have providers go into the patient's room. If the roommate was present, have them leave. If they decided to conduct rounds in the day room, have all patients go into the group room. A lot of times, techs were handing out snacks during treatment team rounds because snack is given out at 10 a.m. Techs were instructed, if the provider chose to round in the day room, to just pass out snacks in the group room. A lot of times, patients were also hanging around the treatment team table waiting for their turn because they wanted to be next because they were ready to be discharged. Staff was instructed to make sure that patients were not just standing around waiting to see the provider or say they forgot a question, so they were hanging around to try to ask a question in between patients. All staff was instructed to make sure patients were giving whatever patient was currently being assessed the proper privacy. And last, I administered surveys for patients and for staff on privacy with the new implementations. And overall, there's an 80% increase in satisfaction for patient privacy. As I already mentioned, 15 staff were interviewed to identify concerns with privacy rounds. Then, based on the information that I received, I created a huddle handout to review with staff. This was kind of just for like a heads up so that they knew a change was coming because I know for me, I like to have a heads up before I have to start implementing new things. So I was able to kind of to go over this with staff before I train them on the new implementations. And I feel like this was really successful and staff was really open to it and they seemed to be really on board with helping implement new changes. And then lastly, I did provide staff education via PowerPoint on the new implementations. I also put in like a gentle reminder on HIPAA just to make sure that we are following HIPAA even when we're not doing rounds. And again, staff was very receptive. I even got to train my unit manager, which was really fun. So overall, I felt like everyone was really eager to implement these changes and they knew that this was a problem for a while. For the completion of strategies, again, patient satisfaction with privacy was assessed. A staff survey was administered to evaluate staff's perspective on patient privacy after the new implementation. However, while I was in the midst of performing these, I really wish that I would have done a survey prior to implementing these changes so that way I could kind of have something to compare it to. I feel like that would have been really interesting. My mentor also made observations during the treatment team rounds to ensure privacy was being protected. And my mentor also noticed that patients seemed more involved and more comfortable in their care since they did have the privacy. And then finally, I wrote a summary on the previous system, the new system, and then the outcomes that were assessed. And then I also wrote improvements, which would be finally having a working conference room. So for the outcomes for the nursing unit, 81% of patients and 80% of staff saw an increase in privacy during the rounds. Again, I wish I would have done a survey prior to, so that way I could give you what the percentages were before the implementation. Secondly, leadership is working on the conference room to be functional on our unit so that way we have a designated area to conduct these rounds. And then also leadership, since I started my project, they have been looking at the way that other units conduct their rounds and providing them with a conference room as well. So I'm really excited about that because this has been an issue on all of the units and it's kind of seems like no one was just doing anything about it. So I'm really happy to hear that for the patients. And then also, the patients felt more comfortable during the rounds. They were more open and honest. Nurses stopped seeing any like inconsistencies with patients' answers to the assessment questions, such as like the withdrawal symptoms, any hallucinations, or any suicidal or homicidal ideations, which was really good. For application and practice, I saw improved communication with patients and the team. We were able to do accurate treatment plans since patients were being more honest about things they were experiencing. Their privacy was protected. I feel like we built better rapport with the patients because we were making an effort to protect their privacy, as well as we were reducing any risk of any lawsuits due to HIPAA, and we were fulfilling our obligation to protect their information. For lifelong learning, I got to advocate for continuous improvement. I got to collaborate and build a better rapport with leadership on this project. I also got to really understand what goes into implementing something and all the research that you have to do prior to. I got experience training staff and enhancing my problem solving skills and analyzing feedback, which I found to be really, really fun. Thank you for listening to the overview of my project, and I can't wait to hear about yours. And these are the references I used for this.